Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir here from the JWC studio, and today I'm joined by the stalwart of gastroenterology in Pune and the region. I've got none other than Dr. Lawate over here. I think your name is synonymous with the speciality, so thank you so much for being here, Doc. It's an absolute honor having you. You've got over 35 years of experience. I could list out all the things that you've done, but by that time, I think our episode would be done. So I thought I'd just let you start with wise words of wisdom. I know that you're a man of few words, but I know they're wise words. So I look forward to being able to chat with you today.
So at the outset, let me thank you for inviting me here.
Absolutely.
And we'll go ahead with
Absolutely. So the first question then is for people who perhaps don't know or they have an idea, what is gastroenterology?
So gastroenterology is a branch which deals with all the digestive organs.
Okay.
There are 7 in all. So we don't, like many specialists, they deal with one organ. Like
Okay, right.
cardiologist is the heart.
Exactly.
But we have 7 organs.
7 organs. Wow.
There are a lot of subspecialties in gastroenterology now.
Right.
In 2025.
Right.
But by and large, we generally deal with all types of digestive problems.
So you look at it as a whole, so to speak.
Yeah, we look at, because they all anyway act in concert with each other. So
Right.
you can't really say your pancreas is affected, but the other things are not.
Yeah, because it's all a
It is
part
all
of the
connected.
one body
It is all
as well.
It's all connected.
So what are the most common things that come to you in terms of, people? I mean, you've
we
been
will
doing this for
actually
years. So
focus more, because liver disease is a topic by itself where
Right.
presentations are very different.
okay,
But from this talk angle, if you look at it,
right,
like I would simplify it by putting it as ABCD.
okay,
These are symptoms with which patients come to us.
right,
So A stands for abdominal pain and acidity.
okay,
B stands for bloating,
okay,
fullness in the
right.
stomach. C for constipation.
See,
And D is diarrhea.
diarrhea. Okay,
So each patient will come in 2 forms. One is with a single complaint or with a combination
of
of.
the ABCC.
And
Okay.
again, some will have an acute presentation where like they've eaten outside and they've had diarrhea, which is a self-limiting thing, which gets cured with a little bit of medical help. But the other thing is what we call as irritable bowel syndrome or
Right.
functional disorders, where you do tests and nothing is found, but the patient has complained. So they have one of these or in combination for a fairly long duration of time,
Right.
and they are quite troubled by it.
And what are the most common ones that you see between these ABCDs?
Between these, I think bloating is quite common that we see.
Oh, really? Bloating is the
Bloating
most
is
common.
quite common, and it often goes with abdominal pain
Okay.
and discomfort.
And what do you think the biggest causes for that is?
For bloating,
For bloating?
so bloating is a subjective feeling where you have the patient tell you that they tell us that my stomach becomes like a 9-month pregnant
Right.
lady after I eat. So this is a very common thing. Or they put their shirt up and tap
Show
on
the-
it
yeah.
and make those noises.
Yeah.
So they have something in the food which generally causes the bloating.
Okay.
And there's a food which is indigested kind of, commonly carbohydrates. And then there's gas formation, and then they get that bloating.
That's actually the most common thing that I also hear from people is that
It's a myth.
the carbs.
One of the commonest is milk, actually, which can get overlooked because the patient has been taking it for like decades.
I see.
Since his childhood.
And that's what causes bloating or
Causes bloating
acid.
if you have lactose intolerance.
If you have, yeah.
If you have lactose.
But that is also something that people can develop over time, right?
It develops slowly over time and sometimes after an infection. So it is quite common.
Okay.
So you go and eat outside, you get an infection. And then you are slightly better, but then you find that every day there's some bloating, some gas, some salt
Right,
in the
right.
stomach. So your stomach is telling, shouting it out and telling that I'm there and there's something wrong with me.
Right.
And you decide what is to be done.
But you have so many people that come and see you. What are the things that always come to your mind that you would always like to tell people from the preventive side of how they should be treating their digestive system? What are the things that, say the two most important things that come to your mind in terms of how you should be having a healthy digestive system?
Yeah, very important, because 2 things I would put. One is the diet content and second is your lifestyle. So both these are equally important.
Yeah.
Now, if I look at my practice, which I started in 89, and today,
Right.
I think today the number of lifestyle related GI disorders
Really?
is tremendously increased.
But
So
by lifestyle, what do you mean?
lifestyle includes various things. So one is your food timings.
Okay.
The second is content in the food and the variation in the food. This is regarding your diet.
Okay.
The second thing is what are your sleep patterns. So nowadays, either because of improper habits or because of your work schedule, you may be sleeping by the American standards.
Okay.
When the sun is rising here, you are sleeping, and the
Okay.
other way around.
So night owl.
Yeah, then exercise is the third thing,
Right.
and stress. So these are common things which we talk about when we speak about lifestyle.
Okay.
So
And
one of
stress has
these-
become such a big factor. People are starting to understand or realize the connection of stress to your digestive system also now.
Yeah, it is very important. Like we experience it right from our childhood. So if there was an exam and your mother said that now you have to go to school, your first paper on.
Yeah.
There are many who go to the toilet and then they feel better. So
That's a good point. Yeah. And actually, that from my personal experience, also from stress, I realized that I can tell when I'm during a stressful period in my time because I get acid reflux then.
Yeah, it is varying. I mean, some people get acid reflux, some get pain,
Exactly.
some get that urge to.
But that's when I realized the strong connection between stress and your
It is.
digestive system. But coming back to food timings, what is the kind of advice you would like to give for
Food
people? for that?
timings, there is no rocket science, but we generally tell the patient you have at about 9 a.m.,
Okay.
1 p.m., 5 p.m., and 9 p.m. So it is breakfast, lunch,
Right.
evening snack, dinner. And you have a wholesome diet. We don't tell patients that you have to be completely off all junk food or something.
Okay. Yeah. You have
It has to be done with
balanced.
common sense, prudence, and
Right.
moderation. So if you do that, I think there should be no problem.
Right. And now everyone is starting to hear about this thing, gut health and microbiome and the leaky gut. Any thoughts on, well, first
Yes,
of all, what
gut
is that?
health actually is, there's no definite criteria which we call as. So all these three terms which you're saying, they're more in lay press. So
Okay.
if you open YouTube, you will find a lot of videos.
Yeah. A lot of
on
people
gut
are
health,
talking about it
on
now.
leaky gut.
Exactly.
And you will not find too many of doctors who are gastroenterologists speaking on them.
Interesting.
So it will be people who are more like the supportive group, counseling group, nutritionists, they'll be talking about.
Very true, actually. That's a good point.
So normally if you look at a gut now, it is a very quiet system. So you will, right now when I'm sitting here, I'm not aware that there's a gut inside.
Yeah. Where is it, first of all?
Gut starts from it in the Indian context, no?
Huh.
Jokingly it is said, it starts with the right hand and ends with your left. So that is the extent of that.
Okay.
So normally we don't know that there's a gut inside.
Yeah.
So when you feel hungry, it tells us we are hungry. That is the time where it announces that yes, I'm there.
Right.
When you start eating and if you eat lot, then the stomach gets distended and ideally it tells you that you have to stop by release of hormones. And one has to listen to it. That is very important.
Yeah.
And third thing is when you get an urge to pass your bowels, that is the time when the gut tells you that I'm there.
Right.
So except for these 3 or 4 circumstances, by and large, you will never know that there's a gut inside which is functioning continuously 24/7.
Right.
But then there are so many factors which will make it announce its presence. So one, like you said, is stress, which can be sudden or long for various reasons. And the second thing is some infection or inflammation.
Okay.
And it can be food which is pungent. In various types, pungent is a very broad term.
Like
So
spicy food or something.
spicy food, lactose intolerant patient.
Right.
So if you have these, then the gut will keep on announcing itself and complaining to you that there's something wrong with me, and then you have to look into it.
Right.
So this actually, one thing is it causes a lot of problems with quality of life, QOL as it is called,
Right.
and sleep related problems because you have these.
So one causes the other,
One-
or other
one-
effect on the
either
other.
ways you look at it.
Yeah. Okay. And then what is this thing that leaky gut? That's another one that people are
Leaky
just.
gut again is a term. No, you will find it if you open a textbook of gastroenterology. You will not really find this term.
Yeah. Interesting that you say that gastroenterologists don't use this term.
No, we
gut
use
or-
it, but we use it because a lot of patients have come asking us, they say, Doc, do I have a leaky gut? Do I have some candida? And what is it?
Right.
So that's the time when we try to address it. So leaky gut basically in very simple terms is an inflammation in the gut, which may be very evident or sometimes it may be very, very subtle.
Okay.
And normally if you look at our inner lining of your intestine, it is like all cells very close to each other, and nothing can enter without going through the cell by and large.
Yeah.
But if you have some inflammation, these channels between two cells open, and there are a lot of things which are not meant to go inside, they will start going inside.
So that's what
And
leaks.
then, yeah, that leaks, and then it may be some food which is an allergen.
Okay.
It may be some bacteria which is going to irritate your gut.
Right.
And then either your immune system gets activated and it starts activating,
I see.
and secreting various things. And then you have, suppose your gut knows that there's something bad inside. It will try and increase its activity, try and push it out. Then you start getting this urge to go to the washroom.
Okay.
You will get colics because of the increased activity. So that's how these symptoms.
And then it goes back again to the quality of life.
Yeah,
of
once
what you
it
mentioned.
goes to quality of life.
Right. But coming back to, pungent foods and things like that, what is your thinking on, people who say that, oh, I shouldn't eat spicy food at all because it causes ulcers or any of those kind of
Ulcers
myths?
is one thing, but the commonest precipitating group of patients is irritable bowel syndrome. So when you speak of diet and GI tract in general, one thing is spicy food. So a lot of people have symptoms for decades, and only thing they have to do is to try and stop your spicy food, and then they become quite all right.
Yeah.
But it gets overlooked because they like it and it's been there from the family.
And especially in India where the
India.
diet is very...
The second thing is lactose, which is very common, which we spoke about. And there's something called as FODMAPs. So it's an
What is that
acronym.
called?
FODMAP.
Okay.
So we won't go into the acronym details.
Right.
There are certain substances which are predominantly carbohydrates.
Okay.
And they are prevalent in all your foods. So if you eat them and if you have a large amount of them, then you can have bloating. So recently there were 2 patients I saw who were apparently taking a very healthy diet and they were eating a lot of fruits.
Fruits.
But, yeah, fruits.
Right.
So there are fruits which are high FODMAP, which are not good actually, and low FODMAP.
Like, for
So you
example...
get the lists on the net.
Okay.
So if you eat a lot of high FODMAP foods, then you can get a lot of bloating and diarrhea and all symptoms which are very similar to. And the last is gluten. So now this gluten also is very peculiar because if you look at it from a gastroenterologist angle, we talk about celiac disease, which is a disease which is properly characterized.
Right.
But then there's something called as non-celiac gluten sensitivity. So the patient does not have celiac disease when you test for it. But when he eats wheat in any form,
Right.
either refined or wheat as such, then he starts getting a lot of symptoms, bloating. So that is non-celiac gluten. So by and large, if you want me to summarize, one is milk,
Right.
second is FODMAPs, third is gluten, and fourth is spicy food. So these are very common kind
Which
of
causes
things.
these...
Yeah, so if there's someone who is getting these symptoms again and again, I would suggest that he looks at his diet, timing, content, variation, and these 4 items in particular.
Interesting. Okay.
And I think in 7 on 10, you will find one of them as a cause for his symptoms.
Okay. That's very interesting. But what are some of these fruits? I'm actually interested to know which ones...
Yeah, so there are fruits like apple,
Okay.
which is very commonly taken.
Right.
It is high FODMAP. So you have, if you go on net, you'll find a list. And people who get, so many times what happens is patient feels that he's eating very healthy diet, he's eating a lot of fruits and fruits. And then when you take his history, then you really find that this is the cause for his
How interesting.
complaints.
Yeah. So what you're actually saying is an apple a day may not actually keep the doctor away.
It may make the doctor come to you.
Yeah, exactly. Well, that's very interesting. I didn't know that. But I mean, you've been doing this now for many years. What are the biggest changes that you've seen over a period of time in terms of your diagnosis and technological advancements that have sort of
One
helped you?
major thing which I would put here is that the age group.
Okay.
So in very simple terms, when I was a medical student, there were 200 medical student admissions in our batch.
Okay.
I don't remember a single student from my batch ever going to a doctor
Really?
for any reason like constipation, bloating, diarrhea.
Okay.
Which age group is say around 20-25. And today there's a marked shift. So we have so many patients in 20s and early 30s who come to us with GI problems. And in our days, they were non-existent. So
Non-existent because they just didn't come to the doctor, or because they actually didn't exist.
because I think the diet patterns, see,
Okay.
there was nothing available by way of what
Processed
you call
foods.
processed food. Very little was available. So
Right.
that I think is a major contributor.
Okay.
The second thing is stress.
Right.
Now, when you talk about stress as a child, if I look at myself, I had a stress-free childhood.
Okay. That's good.
So, for that matter, any child whose home atmosphere was good and was reasonably okay financially would have a stress-free childhood. But now, today, you even look at a poor child or a very rich child. He's going for the exams and there's a traffic jam.
Right.
He gets stressed out. So, there is a child who can get stressed from day to day things which are completely unrelated to his background.
Should we?
and
Absolutely, yeah.
what he's been doing.
I mean, I got
Stress is a very important.
driving here today only. I also was a
Yes,
bit
so
stressed.
you can get stressed out like that. So that is something which has increased tremendously.
Okay.
The other thing which is there is a lot of work on this. So circadian rhythm is when you sleep and you get up.
Yeah, you mentioned sleep as a
Yeah,
one.
so that is changed either by improper lifestyle or many times people who are catering to American, European client.
Yeah.
They have very weird work timings.
Yeah, absolutely.
So which we can't imagine doing.
And as you said, here in Pune, particularly with the IT space, they're also working on funny times and so forth. So I'm sure that also escalates that issue. But I'd have to say that in terms of the circadian rhythm and the sleep timing and the food timing, I've noticed that one thing that's really helped me in the last year and a half is that I've actually really actively tried to eat dinner earlier and then have about a gap of maybe, if I can,
That is
between
perfect.
2 and 3 hours.
That is perfect. Two
before
is
going to sleep.
little unrealistic, but
Yeah, exactly.
you can manage it, but not many can.
when
Say
I
about
can.
an hour's gap also is good enough.
But I've noticed such a big difference that
It
it
makes
makes.
a lot of difference. It makes a lot of difference.
So
And now, if you want to listen to your Apple phones and go by their health apps,
yeah,
so there's a sleep app. I mean,
you're right.
you can time your daily cycle, so it tells you now it's time to sleep, but then you have to listen to it.
Right, exactly.
I mean, now the thing has changed that the child may not listen to his mother, but if the Apple phone tells him that you have to sleep,
You know
he
who
will
the real
listen.
boss is. Yeah, it's crazy how the world is changing. But coming back to you then, Doc, what are the habits or the good habits that you follow for your digestive health?
For myself,
Yeah, given that you know
first thing
so
is
much.
I don't have any habits.
Oh, okay.
So I'm a teetotaler and I don't smoke.
Oh, you mean that way habits?
That
Okay.
habits.
Vices.
The vices, you can say.
Okay.
The second thing is my food timings are regular.
Okay.
So they may be a little off schedule
Right.
from what I told you,
Right.
but they are regular,
Consistent.
consistent. Then primarily I'm a vegetarian, but I eat eggs every day, so for protein. And I make sure that my protein content is adequate.
I was going to say that must be difficult getting good
Yeah,
amount of protein. You have to be mindful.
In the
of it.
Indian context, no,
Right.
it is difficult to get a very good protein intake.
Yeah.
So if you're predominantly a vegetarian, you can't really reach 1 gram per kilogram.
Yeah, exactly.
It is difficult.
So how do you do that?
No, so you can take a protein supplement, which I do,
Oh, you do? Okay.
and
So it's not unsafe for people to take
No.
protein supplements.
if you're milk intolerant, you can take it in water.
Yeah, which is what I do. Yeah.
And the second thing is my processed food intake is extremely low.
Oh, right. Okay.
I mean, I don't want to go into a detailed
Yeah.
summary on this show with
Fair
what
enough.
I eat and what I don't eat.
But it's
But
also.
by and large, these are things, if you do, I think not
Yeah.
too many symptoms.
But I like that that you do take a protein supplement and that you
Yes.
say that it's not unsafe. Because a lot of people have that fear that it's not good for you
If you
or
have
it's
lactose
bad for your
intolerance, you
kidneys.
take it in
Right.
water. It's rough. Or you can take lactose-free milk.
Right. Absolutely. And then what do you do to keep the stress away? I know that you're a very avid keyboard player and a very good photographer as well.
Yeah, I do those things. But 2 or 3 things by nature, I'm not very stress-prone person.
Okay.
So I always tell our residents that even if there's a very, very bad patient,
Yeah.
it does not cause stress to me. I mean, it can't be zero, but
Right.
it is very minimal.
Okay.
So about stress, I think there are 4 types of stress according to me.
Okay. Absolutely.
So one is a circumstantial stress.
Hmm.
So it can be an acute circumstance, like I told about the boy who is going for the exam.
Right.
And there's a traffic jam. That's an acute
Immediate
circumstantial
reaction,
stress. It is beyond your control. Or if your workplace is not good, there's some family affairs and which are not going on well. Then you can have circumstantial stress, finances maybe.
Yeah.
The second is self-induced stress. So I know that I cannot reach for my appointments at 12, but I start giving appointments from 12. Or in IT field, you have some projects
Yeah.
and there is a deadline which you know you cannot finish,
Right.
but you give an earlier deadline because you have that ambition that I.
Okay.
So then it's a self-induced stress.
Setting
So you are
yourself up
putting
for
wrong
failure.
deadlines and then you're getting stressed out. The third is a stress-prone personality. So that is very common.
Okay.
So for every day-to-day thing, like if I was a stress-prone personality while coming here, I would be all stressed out.
Right.
Traffic, podcast, whether I can reach, what is going to ask. So if you're a stress-prone person, each small thing will cause stress. If your child has gone out, he'll start feeling 15 minutes late what happened.
Right.
And the fourth is more common in our branch. So you have a lot of patients who have this IBS, irritable bowel syndrome.
What is IPS?
Irritable bowel syndrome.
Okay.
So they have a lot of problems which are going on for years and years. They have visited so many doctors. They have taken treatments. They have spent a lot.
Yeah.
And they are not relieved. So that is a secondary stress. So these four stresses is what over the years or decades you can say this is what I've learned about stress. And if you put them in one of these boxes, some can have all four boxes ticked. Some may have one.
Right.
So the first one, like circumstantial stress, is something which you really cannot do anything about unless you change your job or you change your family. Or
So just accept it.
It is the thing.
Okay.
Circumstantial stress, which is acute, you will get over. If you're stress prone, I think you need some counseling.
Right. Which is absolutely fine.
Which is absolutely fine.
Right.
We encourage people to do that. And so that's about stress in very
Broad
brief.
terms.
That is in broad terms. But if any person is listening to this, he is having stress of some kind, and he puts his stress in one of these four boxes, I think it may be easier for that person to tackle the stress.
Yeah. And we must all get...
And it will make his doctor's job also easier.
Yeah. We must all get inspired by you about how to live a stress-free life as much as possible. Well, it's been absolutely fascinating talking to you, Doc, getting all the insights from everything about the digestive system. Any last thoughts or any important message that you'd like to leave us with?
Your gut is your health, basically. If you have a good gut, your body is good, your mind is good.
Right.
And you can enjoy your food and do everything. So I think pay attention to your lifestyle, pay attention to the food you eat. Don't get stressed out.
Yeah.
Don't read too much of
the internet
things on the internet,
right,
which will tell you what to eat, what not to eat.
So trust
and
your
go
gut.
by your own senses, and you will be happy, and you will have a happy gut.
Good. So trust your gut. Thank you so much, Doc, for being here. I appreciate you being here.
Thank you very much.
Thank you all, and look forward to seeing you next week for another episode. But before you leave, do not forget to hit the like and subscribe button here at the bottom. Thank you.